Welcome everyone, my name is Maria and today we are going to learn about peripheral vascular disease. As you all know, I'm a nurse educator, so I do gear my lectures towards nursing students, but if this helps any student, that's what I'm here for. So if you enjoy, please subscribe to my page. You'll see a lot more videos related to content that I'm lecturing on today. So, peripheral vascular disease. I really want you to stick into your mind your distal veins and arteries. We are not talking about our major coronary arteries or our cerebral arteries. We are thinking primarily in our legs. That's where these disorders most commonly occur. And we are just going to think one affects the arteries and one affects the veins. And what is affecting our arteries or veins is we are starting to get an obstruction of blood flow, either related to lipid and cholesterol buildup, atherosclerosis, or even glucose that builds up in the lumen of our vessels. Platelets can aggregate in the lumen of our vessels. So there's a lot of things that can build up in our veins and arteries. But either way, whatever is building up is impairing blood flow. So I really want y'all to think in terms of your nursing process. ABPI. We always have to gather our data first, or our assessment, to figure out the best way to act, our intervention. So we're going to talk about the differences in assessment between your arterial and your venous disorders, and then we're going to talk about universal interventions for both, which is in the middle of the heart, and separate interventions that are appropriate for each disorder. So let's start with arterial disorder. So, as you can see, according to my poorly drawn heart, we are thinking our heart sends oxygenated blood, and I'm using the example of my foot, to my foot. And the obstruction of blood flow is in my artery. So let's think about this. The core problem of our arterial disorders is I cannot get oxygenated blood to my foot. So it's going to show you, if you're a visual learner, or think about how the blood flows, these symptoms that will present. So let's talk about pain first. These type of individuals have something called intermittent claudication or rest pain. So with activity, you know our blood flow is increased. So our blood flow is increased, but look, all this congestion is going to occur before the obstruction. So the blood's not getting to our foot, but it's going to start congesting above the area of obstruction. So intermittent claudication is actually this excruciating, sharp shooting calf pain that occurs especially with activity. Or these clients have rest pain. Let's think about this. The primary problem with arterial disorders is the blood cannot get, pretend this is my heart, this is my foot. The blood cannot get from my heart to my foot. So when we elevate our legs, we are exacerbating the problem, because if we hang them low by gravity, at least we're helping to get some blood to my foot. Because remember, the obstruction could be just in one artery or a couple. We still have other arteries that can perfuse that foot with oxygen. So when we rest, for these clients, all the blood again is congesting and getting exacerbated. So a lot of times they'll wake up in the middle of the night with rest pain because of us worsening the condition by elevating the leg, and then a lot of times they'll throw their legs over the side of the bed to try to help that blood flow to the foot again by gravity. So they can have intermittent claudication, sharp shooting calf pain with activity, or rest pain. Let's talk about pulses. So if you always think with arterial disorders, the difficulty is getting oxygenated blood from my heart to my foot, you can start thinking about how the pulse would feel. Remember, we always assess pulses bilaterally. So if we're assessing our distal extremities, you should be assessing your right pedal pulse to your left pedal pulse, or your right posterior tibialis pulse to your left posterior tibialis pulse. So again, if the problem is getting that blood to the foot, the pulse could be absent, or it could be weak. We can have unequal pulses if we have obstruction on our right side, but no obstruction on our left side. So the pulse on our right side related to the obstruction might be a +1, very weak or thready, or even absent, compared to our normal +2 pulse on this side, because there's no obstruction in the artery on our left leg. And now edema. we are having difficulty getting that oxygenated blood to our foot. So do we have any fluid to congest in our foot? No, we don't have anything to swell because the obstruction is before we get to that distal extremity, before we get to our foot. And I always use the example of a foot. So we will not have edema with our arterial disorders. The temperature, again, we are not getting blood from our heart to our foot. So the feet and the legs can be very cool. The color can be very pale, again related to a lack of oxygenated blood flow. They have a coloring called elevated pallor dependent rhubarb, and again with elevation we are worsening the problem of getting oxygenated blood flow to the foot, so the extremity becomes very pale. But if we hang it down, the blood will congest in the area above the obstruction. So that's called dependent rhubarb, because with all of that congestion, it can make a reddening or a pinkish color of the skin. So their color can be either pale, or you might hear elevated pallor or dependent rhubarb. And then let's talk about wounds. The wounds with arterial disorders are related to a lack of oxygen deprivation that starts to break down our tissue. So our wounds will be very deep, because anytime we have a wound related to necrosis or ischemia, which is a lack of oxygen to our tissues, they can be very deep in nature, very painful, and the edges will be very even and defined. There'll be a nice round shape, because again, it's related to oxygen getting to that distal extremity. And then typically arterial wounds have very little drainage, because there's no oxygenated blood getting there, or minimal oxygenated blood. So it's not developing a lot of edema, as we saw. There's not a lot of fluid buildup, as we saw. So that's how we're going to think about our arterial disorders. I do want to put a couple miscellaneous assessment data that you'll notice. With our arterial disorders, you can see blood pressure measurement changes. It is normal for our blood pressure measurements to be much more elevated in our legs than our arms. But think, if we have a problem getting that oxygenated blood flow to our leg, that will affect our blood pressure measurement. So with our arterial disorders, you might not see it higher in the legs. You might see it similar or even lower than the blood pressure in our arms, which is not normal. And then anytime we have a lack of oxygen, you can have no hair growth. A lot of times we have a thickening of our nails related to oxygen deprivation, very dry skin, just a lack of nutrients in general. So that is our assessment for our arterial disorder. And please just think about, which way do arteries take blood? Where are they taking it to? And remember, the obstruction is in the artery, not the vein. And then on the opposite side, still talking about assessment, we're going to talk about our venous disorders, so peripheral venous disease. So now, as opposed to the artery, the obstruction, whatever is built up, fat, cholesterol, platelets, glucose, is now blocking. We have no difficulty getting oxygen from our heart to our foot. The problem is getting that deoxygenated blood back to the heart. So you're going to think about a lot of congestion in that distal extremity, okay? But remember, still has blood flow. So let's talk about pain. All that congestion, so oxygenated blood gets to our foot and now cannot get back to the heart. So all the congestion of fluid and blood in our distal extremity can lead to this constant pain, a dull, achy pain at all times related to congestion. And if we think about pulses, again, no problem getting oxygenated blood through our artery to our foot. The problem is getting that deoxygenated blood back. So this extremity will have a pulse. There's no impairment of oxygen delivered to that foot. But in terms of pulse assessment, we might not be able to palpate the pulse because these extremities are typically very edematous. Think about all of the fluid that's getting congested related to that obstruction of blood flow back to the heart. So they'll have a positive pulse. Their skin will be very warm because, again, they're getting oxygen to that foot, but we might not be able to palpate that pulse through edema. So if you ever have a concern and you do your peripheral vascular assessment and they're not having any other issues besides edema, not being able to feel a pulse, you can always grab your Doppler and make sure to assess blood flow in that extremity. Because we always, with these disorders, whether it be arterial or venous, need to verify blood flow. And then in terms of the color is related again to this congestion of fluid and blood in that distal extremity. And we call it stasis dermatitis. If you've ever seen this, a lot of times it's a brown discoloration that stays on the leg, and it starts lower and then starts working its way up the calf. It's again relating to that pooling of blood just sitting there, trying to get back to the heart. So it's this constant brown discoloration of the skin that can work its way up the leg that you can see on clients. And then let's talk about wounds. The wounds that occur are not related to a lack of oxygen deprivation because oxygens get to the foot. When I like to think about wounds for venous disorders, I like to think about there is so much fluid sitting in that foot that sometimes that fluid starts to weep or seep out of the client's tissue. So we know we like to keep skin clean and dry. But with this fluid constantly congested, it's going to have to go somewhere, and a lot of times it seeps out of the tissues onto the client's healthy skin. So you can start see a breakdown of skin related to fluid sitting on it. So this breakdown is not going to be these well-defined, round, even borders. It's going to be irregular in nature because it's dependent on where that fluid is sitting. It's going to be very superficial because it's not related to ischemia or necrosis. A lot of times the wound beds are still pink and don't show any signs of duskiness or bluish discoloration or black discoloration that you can see with your arterial wounds because, again, they have blood flow. It's just related to all that fluid congestion sitting there. And a lot of times, a lot of drainage. Again, because all the fluid sitting in those distal extremities. So superficial, irregular borders, a lot of drainage. So a big goal of wound care with these clients is to keep that healthy skin clean and dry. A lot of wound care goals for your arterial clients is to ensure that we are perfusing or getting oxygenated blood to that foot as best as we can. Okay? So this is your assessment data for venous versus arterial disorders. That is the A and ADPI. We've collected our data. So let's think about how do we act as nurses? What is our interventions? What are appropriate ways we can help our clients? So in the middle of my heart, we have universals for both sides. You have a problem with the blood flow, one way or another, via the vein or the artery for these clients. So it is essential to be doing a peripheral vascular assessment on them frequently. You need to be assessing the blood flow in their extremities. So I always like to think about my 5 Ps. My 5 Ps show signs of circulatory compromise. So if they are having pain in their extremity for no reason, that is not normal. If they do not have pulses or weak pulses, that is not normal for a healthy client. Paralysis. A healthy client should always be able to move their extremities if asked to do so. Again, we're not talking about disorders that can affect movement such as cerebrovascular accidents, your strokes, or your spinal disorders. But if me as a healthy client, somebody asks me to move my leg, I should be able to do so. So clients should never have paralysis. They should not have paresthesias on a constant basis or that numbness and tingling. Or be pale chronically. So if we start to see these symptoms in a client, we might need to start thinking that their circulation could be compromised in one way or another. So always do a peripheral vascular assessment. And of course, this is just the 5 Ps. Cap refill, when you're assessing the cap refill in the client, you press down on the nail bed and it blanches, but the lightening of the color should always return back to the normal color within 3 seconds or less than 3 seconds. That shows appropriate blood flow. So we should be assessing cap refill and everything else related to circulation that you've been taught in your physical assessment. Safety. Whenever we have a problem with impaired blood flow, you have to keep these clients safe. Meaning, impaired blood flow can affect sensation. They might not be able to feel if they step on a nail or they cut their foot. So we need to educate these clients to always wear sturdy shoes, to never go barefoot, to never wear restrictive clothing. We don't need to compromise blood flow further by wearing clothes that are too tight for us. Not crossing legs for long periods of time, okay? So keep them safe. Don't ever expose them to extremes in temperatures, especially heat. Clients with these disorders using heating pads, they might not be able to feel related to a lack of sensation if that heating pad starts to burn them. So please always be careful with heating pads or any types of heat. We don't like cold for these clients either, ice bags or anything like that, because think coldness vasoconstricts. So it will impair the blood flow in the vessels just related to vasoconstriction. And then lifestyle. If there is any lifestyle that has attributed to these diseases, such as they could have atherosclerosis, the buildup of fatty lipids and cholesterol in our arteries especially, we need to educate on diet. We need to ensure that they're on a low-fat, low-cholesterol diet. Exercise is always good. We would never tell a client with a circulatory disorder, a venous or with PVD or PAD, to not exercise. Exercise helps promote blood flow. Even with intermittent claudication, we would tell these clients to exercise to the point of pain, rest, and then continue exercising once that pain subsides. So, healthy diet, exercise, smoking cessation. We always encourage clients to stop smoking. There's no decreasing in smoking. In our NCLEX perfect world, and really the real world, we need to educate on stopping all smoking, because smoking vasoconstricts blood vessels. It increases oxygen demand. So we need to stop smoking if the client smokes. And always follow appropriate wound care. And ensure to keep the blood perfusing to the extremities as best as possible, and keep that skin clean and dry. So, other interventions that are different related to the disorder is especially positioning. So always think about what is impaired. With my arterial disorder, I cannot get the blood from my heart to my foot. So the best positioning is to hang the legs dependent, because by gravity, it will help pull as much oxygenated blood to the foot as possible. With our venous disorders, there is no problem getting the blood from the heart to the foot. The problem is getting that deoxygenated blood back from the foot to the heart. So if we elevate these clients' extremities by gravity, we can help get that blood back to the heart, okay? So think dependent positioning for arterial disorders and elevated positioning for our venous disorders. And the last thing I want to talk about today is TEDs and SEDs. Your TEDs, your restrictive, I shouldn't say restrictive, they look like stockings that can go up to your knees or can be thigh high. They help push stagnant blood in our extremities back to our heart, help recirculate it back to our heart. TEDs and your sequential compression devices, which work similarly, they have a inflation and deflation motion, which allows the recirculation of blood from distal extremities back to the heart, are very appropriate and recommended in our venous disorders. But if we put TEDs on our arterial disorders, TEDs, the purpose of TEDs and SEDs, again, are to push the blood in our distal extremities back to the heart. But remember, with arterial disorders, the problem is getting that oxygenated blood to our foot in the first place. We do not recommend TEDs and SEDs for our arterial disorder clients. So, you have your assessment data, you have your interventions universally in the middle of the heart for both, and then the differences related to the disorder, especially related to positioning and the use of TEDs and SEDs. But always, in ADPI, evaluate. When we're gathering all this data, in my evaluation, I always like to think, am I helping the client, or are we leading to complications? So always be mindful with your arterial disorders to look for the complication of obstruction, of complete loss of blood flow, because these clients might actually potentially need an amputation if we don't ensure perfusion of blood to that extremity. On the opposite end, with your venous disorders, I would always make sure to look for the complication of a DVT, a deep vein thrombosis, because as you all know, DVTs could lead to the life-threatening complication of a PE, a pulmonary embolism, if that clot dislodges and travels to our lungs. So think about ADPI, always look for complications, and always take the material that your instructor gives you if you're a visual learner like I am, and if they have more assessment data than I have, plug it in. If they have more interventions than I have, plug it in. This is just a general understanding, but always tailor your studying to making you successful on your tests for your courses. So take your instructor's information and just add it in addition to whatever I've taught you today. So always have a wonderful day, and make sure we are better together. So if this has helped you, if you have a good understanding, please help another student or gear them towards this video so that we can all be successful. Take care.